Okay, so I will start. I'll share my screen. Okay, so anyone have any idea what do you mean by documentation? Anything? What comes in your mind whenever we say documentation? Yes? Hello, am I audible?
Yes, ma'am.
Yes, ma'am.
Okay, what do you mean
Yes,
by
ma'am.
documentation? I think you must have heard, right? We used to say document, we have to document, we have to. What is documentation?
Collecting important information.
Okay, somehow actually when we say documentation, it means we have to write down, we have to note down something. So like here what we say in the here, documentation is a very important thing which we need to do, because what happens if you don't document anything, whatever how much you are doing, how much you are struggling, if you don't document, it is like it's not done. Okay, so documentation is like a proof for whatever activities you are doing, anything that you're doing, that is called as a documentation. So whenever we say documentation means it is how we have to write down. Okay, we have to note down whatever, suppose for example, or this you have done something for your patient. Suppose if you go to the hospital, okay, so you have checked the blood pressure of that particular patient. So once you complete that, you will go and write it down. So that is called as the documentation. And reporting, what is reporting? It is what, how is it different? Documentation is something which is very permanent, where we used to keep, we have the, like suppose for example of documentation is like your recording. Okay, we have different types of records that also will be taught later. Then when we say reporting, it's something which it can be done either orally or it can be something in the form of written. Okay, or we can write it down or we can just say it orally. Suppose if you want to report something, so it just directly you can just call that person and you can report, okay, I want to report this. So that is called as the oral reporting. And sometimes reporting also can be done in the form of documenting, or you will just write it down. Okay. So, recording and reporting are two major communication techniques used by healthcare professionals. And if you see everywhere, okay, we have to, that's why it is a very important aspects of healthcare services. Without recording, without reporting, like I've said, even how much you have done, without documenting it, there's no proof that you have actually done it. So you have to always record and keep all the records and report. And it is also one thing which really helped the nurse. Suppose if there is any situation later where the person's situation becomes bad, but if you keep it recorded, then they will be able to know, okay, you have already done this, but it is not because of you that the patient is having those problem or his situation becomes worse. So that's why we should always keep the recording and reporting. Documentation serve as a permanent record of client information and care. So like I said, whatever you are recorded, this will you be more clear when you'll go for your clinical posting, where you'll be seeing like all the nurse, okay? So in each, for each and every patient, we usually have so many documentation, be it the doctors, be it the nurses, and so many things we used to keep in the document file of every patient. So why do we keep this? This is like a recording that we have actually done this, what are the things that the patient have done, what are the things that we have actually do for the patient. So we always keep the documentation. Reporting takes place when two or more people share information about the client's care. Okay, so like I've said, suppose if you have done for if you have done a blood pressure checking of one patient, you can just report it to the, suppose you can report it either face to face, okay, you will inform your friend, okay, me, I have checked the blood pressure of that patient. Or sometimes you can even inform it through telephone, okay, you can call over and you can inform. That is the meaning of the word reporting. So reporting is something which is, if you compare reporting and recording, Recording is something which is really, which is permanent, where you usually write down. But when we say report, it can be either orally, or it can be also, we can just write it down, but it is not something which really remains permanent. Okay. Then documentation is defined as a written evidence of the interactions between and among the healthcare workers, the clients, their families, and the healthcare organization. So, like I've said, in each and every, for each and every patient, we have a one file, okay, and in that file we have all the record. Suppose it's admission record, okay, then which will be done from the admission department, then the nurse's record, where the nurse will record whatever activities she is doing for that particular patient, be it checking his vital signs or blood pressure, and the doctors, okay, we have to also have the doctor's record, where he will write whatever in, what is the progress of that patient, okay. So all these, and not only that, even for the non-healthcare professionals, okay, they always keep records. Suppose they help the housekeeping. Housekeeping is that those department which help in overall keep providing the clothing for the patient, cleaning the patient's this one room, and also even for them also they used to maintain their own separate record. Okay, so it is a very important evidence, and with the help of record. So suppose if you have done for that patient, so if our doctor wants to know whether that nurses have really checked the blood pressure of that patient, so he can just go through the client's file and he can say, okay, she have done. So it is like an interaction, even though you might not interact directly with the nurse, but the doctor, he will know, okay, the nurse have already checked the blood pressure. So like that, it is forms as an interaction, even though it might not be directly interacting or talking, but with the help of the record, by just going through the record, we will be able to know what are the activities done by the various people involving in the patient care. Okay, the results of the client responses to these diagnostic tests and interventions. Okay, so with help of documentation also, we'll be able to know, okay, the client when we document, we will write, okay, the client today, his blood pressure was normal, it was 120/80. Then tomorrow you see from the recording, okay, that the blood pressure, it shoots up, maybe it reach above normal, like 140/90. So with the help of this, you'll be able to know, okay, whether the patient is really responding well to the treatment, or he needs some changes in his medication or in his treatment. Okay, so when we say intervention, means whatever things you are doing for your patient, that is a meaning of the word intervention. Intervention is like implementing. Okay, so these words also you'll be more clear when you learn about your nursing process, okay, where we have all the steps of the nursing process or the nursing care. Okay, so this is the meaning of the word documentation. So when we see with the, what do you mean by documentation? Okay, documentation is anything which is written or printed on which you can rely as a record or proof of patient actions and activities. Okay, like I've already repeatedly say, documentation is something which you write down, which you note down, whatever you have done for the patient, be it small, even something which you cannot do for the patient also. Suppose if you are planning to give one medication to a patient, but the patient is not, he don't wants to take the medication, so even for that also you can write down that the patient refused to take medication. So in this way it will help you, it will save you, because sometime what happen if the patient situation might become worse because of not taking that particular medicine, so you will not be at fault. Okay, so they will know that, okay, the patient does not take the medicine, it is because of his own will, not that the nurses didn't give him. Okay, so it really helps as a proof, or whatever actions or whatever activities you are doing. Okay, that is the meaning of the word documentation. Okay, so next will be record. Okay, so record and documentation, it is same. Okay, so even in documentation is something that we write down, even recording also, these are the things which we used to note down or write down. So when we say what is a record, okay, so this is according to the TNAI, is full form is the Trained Nurses Association of India. Okay, so whoever nurse after they are trained, suppose even for you all, after you have done your BSc nursing, you have to register yourself under this. So all this is like an association for all the nurses that have already been trained. Okay, Trained Nurses Association of India. So a record, it is a clinical, scientific, okay, administrative and legal document related to the nursing care given to the individual, family and community. Okay, it is a record from the admission of the patient till he is discharged. Okay, so what is we when we say clinical? Clinical is something which you are doing for the patient. Suppose you are giving Suppose a doctor, he came and he have done the physical examination of the client, so that is something which is related to the clinical. So a nurse, she will check the blood pressure, so that is also something which is called clinical. Then we say scientific. Scientific is something which really helps in providing the proof. Okay, so it's like a scientific proof for whatever activities or action you are doing for your client. Administrative. So even in administrative also, administrative, because so many activities or actions are being done under the each and every organization. Suppose a hospital is one form of an organization. Okay, so under the organization we have so many people involved in the caring of the patient. So even for them, okay, they have some administrative bodies or the head of the hospital. So even for them, this record is also very important form of knowing, okay, who really have done what for the patient. So they will know, okay, these department or these physician have done this much for the patient, so the nurses have done this much for the patient. So it also help the administrative people to know, okay, what have been done for the patient. And legal documents. Why legal document? Because that's why whenever we note down anything in the patient's document, we should not note down anything false or any false information. Because what happened later, if something happens to the patient, suppose a patient suddenly dies because of any unknown reason, very suspicious type. So whoever are caring for the patient, whoever are under taking care of the patient, they will be legally responsible. So that's why by keeping the document by maintaining the principles, which I will inform you later what are the principles, so you will be safe. Okay, so they will be going through the documents of that file of that patient who is having any legal case. Okay, then they will see, okay, really you have already done whatever you need to do, you didn't do anything wrong. So it will helps also in what it helps in saving the nurse, the physicians. Okay, so it acts as a legal documents. So that's why all the patient's records file, it is after the patient is discharged, we always keep it very safe in some medical record or this other medical record department. They used to maintain it because it is a very important legal document, and we should not share any of the information of your patient to any unknown person or to any other people who are not involving in a patient care. Okay, so all the documentation, it should always be kept confidential. Okay, you should keep it safe and we should keep it confidential. Okay, so this is the meaning of the word record. And whenever we say record in a hospital, when do we record? We record starting from the admission. If suppose if you go in one hospital, first and foremost, when you go there, you'll be going to the registration counter. From there, your documentation started. They will ask your details, your name, your age. Okay, then once if you need to be admitted to the hospital, then similarly when you stay in the hospital, throughout the time you are there in the hospital, all the patient care, everything that you are doing for the patient, it will be recorded. Okay, till the patient is discharged. So all this, it is the meaning of the word record. Are you clear with this?
Yes, ma'am.
Please respond.
Yes, ma'am.
Okay, so
Yes,
don't
ma'am.
be confused with
Yes,
documentation and record. Documentation and record is same only. Okay, recording is something that you write, and when you say report is something which you can report. Also, suppose we used to say, "Now I have reported." Suppose even in your class, suppose if somebody is have done something, you used to say, "Okay, I have reported you to the principal." So that is something which you can even do it verbally. You can just tell over the person's like face to face, or you can even call. Okay, sometimes even report also, sometimes we used to make some it can also be in the written form. Okay, but when we say record means it should be something in the written form, and it always stays permanent. Okay, so why do we record? Okay, what are the main purposes of recording? Okay, the first thing it says communication. So like I said, I have already given the example. Suppose if a doctor or a nurse, even a nurse, if suppose if she wants to see whether what are the advice of one doctor for that patient, so she can, without communicating with that patient also, just by taking the patient's file, flipping the pages, okay, she'll be seeing, okay, the physician notes. So from there also she'll know, okay, the physician have ordered or the doctor have ordered these type of advices for the patient. So it forms as a basis of communication. Okay, communication means interaction. Okay, where you will get all the information. So like this, This is also one main purposes of recording. The second is legal documentation. So like I've said, it acts as an evidence in the court of law, because we don't know, anyone can be, because as human beings sometimes we tend to make mistake, not intentionally, but okay, unintentionally it might happen. Okay, sometimes we might forgot to give the medicine to the patient, sometimes we might, by mistake we might give wrong medication. So in this type of situations, so if documentation is very important. Okay, so with the documents, if you document everything properly, whatever you have done, so even if that problem arises, okay, it will really shows that okay, maybe you have not really done the, you have not really committed the crime, so it really helps, so it forms as a evidence. The next, it says research. Okay, so research, you might not be so much clear now because you, so because you have not done any, okay, but when you grow, okay, when you'll be in third year and all, you'll be doing some research. So research also is something where we will try to find out the answers. Okay, when we say research means we try to find out the answers. So sometimes, suppose some people want to research on how many days a patient stays back after getting a surgery. Okay, so they will go to the hospital, they will try to take up the record, and by seeing the record they will know, okay, this, okay, a person usually stays up for at least 3 days after getting a appendectomy. That means removal of the appendix. Okay, so like that, it acts as a research documentation. Then statistics, how is it? Because by keeping the record in a hospital, you'll be able to know, okay, for this year this much of patient have been treated with appendectomy, or have been treated with fever. So it acts as a statistic is something which will really provide information about the patient, about the hospital services, or even about what is the status of the people in that particular area. Okay, so by giving the record, you'll be able to know, okay, it will give you a statistics of how many people have been discharged from this hospital, how many people have been recovered, how many people have been admitted. So it helps in the statistics. The next, it says education. Okay, so education, how it will help. Okay, for example, you are still in first year. Okay, so when you go for your clinics, you have you need to learn, you will be, with the help of the record, whatever record is there of your patient's file, by seeing the file you will be able to at least get some, okay, you'll be able to know, suppose a patient admitted with fever. Okay, so what is there under the, what is there under the record. Okay, what type of what is the vital signs of that particular patient. Vital signs means the temperature, pulse, respiration. Okay, so by seeing the patient's file, you will be getting a lot of information. You can learn so many things from the patient's file. Okay, the next is audit and quality assurance. So audit, when we say audit, means it monitors the quality of the care. Okay, sorry, some spelling mistake. It should be care. It monitors the quality of the care received by the clients and the competence of the healthcare providers. When we see quality assurance, in simple terms, which we can see is when we try to really find out whether the particular hospital is really providing the quality care or not. We will try to monitor that. And in order to monitor that, we usually have this audit. Okay, so this audit and quality assurance, you'll be more clear when you reach your fourth year and all, when you'll be having these in your management. Okay, but just remember, when we say quality assurance, from the word itself, it's like we are trying to monitor whether really the nurses or the doctors are really helping the patient by providing the patient with quality care, okay, or by maintaining some standards. The next is, say, planning the client care. Okay, so it provides data which the entire health team uses to plan the care for the clients. Okay, so like I've said, so with just one glance of a patient file, you'll be able to know. Okay, suppose what are the planning for the patient. So if so a doctor, by seeing the nurse's record, okay, she have mentioned that the patient is responsive now, he is active. So by looking at that, he'll be able to know, okay, the patient's now, he is a bit improving, so the doctor might change again the medication. So it helps like that, it helps in the how to plan the patient's care. Okay, so these are the things which comes under your Why do we need recording? Okay, so first it helps in the communication. Okay, second is a legal documentation where it acts as an evidence. Okay, in the court of law. Then next we have for research where we try to find out some answers, some solution. Okay, then statistics, like I've said, it will provide us a very brief information about, okay, suppose for example, how many people are admitted, how many people have been discharged, okay, how many people have recovered from any form of illness or disease, okay. Then educations. So how it helps in educations with the help of the record, various record that is maintained in a hospital. So by just by going through the record also, we can get some knowledge about the patient, about what is his condition, okay, what his treatment has been received, all those. And audit and quality assurance means where we are trying to monitor the quality of care, whether the patient is really being provided with a quality care or not. And it also helps in checking the competency of the healthcare providers. That means it will check whether they really the healthcare providers is providing the patients with quality care. When we say healthcare providers, it means the nurses, the doctors, the pharmacists, the radiologists. So many people are there, which we call it as healthcare providers. Okay. Then planning the client care. So by seeing the patient's record, you'll be able to know. Like for example, I have already told about the doctors, how the doctors, by seeing the nurse's record of the patient's file, he will be able to know that, okay, what is the condition of that patient? And based on that, he can plan or make some changes in the treatment. Okay. So likewise, even the other healthcare professionals also, they can make use of that record. Okay. Do you have any question? Please answer.
No.
Yes.
No, ma'am.
No, ma'am.
Did you understand or you don't understand anything? Say. Yes. Am I too fast?
Ma'am,
Huh? Yes.
ma'am, can you repeat the definition of record?
Okay, we wanted to repeat the definition of record. Okay, so a record is a clinical. So like I said, clinical is something which you do for the patient clinically. Like suppose for example, a doctor, okay, a doctor, he will be providing he will go to the patient and he will do some physical examination, okay, or he will give some treatment. So that type of record is called as a clinical record, okay. Then scientific, like I've said, scientific, it acts as a proof, okay. So it also acts as a scientific evidence. Whenever we say scientific evidence, it means something which is scientific, means that something, whatever you're doing, there is a proof behind or a reason behind that action that you are doing. Then administrative means what, like I've said, like for example, a hospital is one organization, okay, and in this organization we have so many administrative bodies or the administrative people who are the leader or who are looking after the hospital. So even in administration also, what happens, we need to maintain all the records. So by maintaining the record, they will be able to know, okay, these type of suppose the physician, okay, what are the activities done by the physician, what are the activities that have been done by the doctors, by the nurses, okay. So like this, the administration also, it helps in the administration of the hospital. Then legal documents, like I've said, it is something related to the law, okay. So that's why they always used to say that we have to always maintain a very proper documentation, because like I've said, something or the other, what happens, something might happen to your patient, and they will go through the patient's file and they will be able to see, okay, whether you have really done something or whether you didn't do it. So it acts as a evidence or acts as a proof, okay, for all the activities that you're doing for your patient. Okay, so and all these, it is related to the whatever care you are giving. It can be either to the individual, family, or community. So that is called as a record. Okay, so in simple terms, what you can say, a record is something that is written, okay, whatever, anything that is written related to the patient care or activities, that is also called as a record, in simple word, if you want to know. Okay, so a record is something that you note down related to your patient care. If you say nursing record, okay? Anyone have any question? Okay, if you want it to be more simplified, I can give you another definition of record, okay? Yes? Are you clear?
Yes, ma'am.
Okay, in the next class, I'll give you another definition of record. Okay, this might be a bit complicated for you, okay, to understand because you don't know what is administration, you don't know what is scientific and all this thing. Okay, so I'll give you another definition, simple definition of record. Okay, but just for the time being, you know that record is something that we write down. Whatever we write down. Okay, suppose medical record, your health record. Health record means what? Whatever, suppose after you go to a hospital, they will take your they will do your physical examination, so they will write it down. That is also one form of record. Okay, so even your examination, in your exam you are writing down the answers. Okay, that is also a form of record that you have done your exam. So record is something that you write down. It can be related to anything. Okay, that is called as a record. Okay, so the types of records I'll be taking into the next class, okay, because I have to attend some meeting. Okay, for now you just remember this, that record is something that we write down. Okay, that is means whatever you are writing down, noting down, that is called as a record. And a report is something that you can also just give the information either verbally, you can just inform the person face to face, or you can even give the information through the telephone. Okay, fine. Yes.
Yes, ma'am.
Yes, ma'am.
Okay, so
Okay,
if
ma'am.
you're confused, like I've said, I'll give you a simple definition because this one I have prepared for other batch. No? So for first year level, it's a bit difficult, the definition you might not understand because you don't know what is administration, scientific and all this. So I'll be giving you a simple definition in the next class. Okay, so actually we have so many types of records, okay, in which we maintain in the hospital. That just briefly I'll show you. We have the medical record, we have the nursing record. So all this thing actually it will be more clear when you go for a clinical posting. I can show you, okay, in the hospital. Then we have the ward record. So these are the things which comes under the record. Okay, anyhow, we will discuss in the next class about the types of records and what are the guidelines, okay, that we have to maintain also. Somebody cannot hear my voice. Helmina? Helmina is here. Hello. Okay. I will see you in the next class. Okay. So in the next class, I will discuss about all the other related to the types of records. And we also have the methods also how we can record. Okay. Methods of recording. Okay, fine. Okay. Thank you, everyone. I'll see you in the next
Thank
class.
you, ma'am.
Thank you, ma'am.
Thank you, ma'am.